Top 3 vegetables that lower creatinine fast doctor's guide. If your creatinine level keeps rising even though you are trying everything, you are not alone. Many stage 3 kidney patients feel shocked when they learn that everyday habits silently increase waste buildup in the blood. Creatinine is only a signal, not the root problem, and you can support healthier filtration with the right choices. Today's guide breaks down 3 powerful foods that help your kidneys filter more efficiently. Do not miss the second one because it surprises most people. And at the end, a bonus tip can speed up your progress. We will start with a vegetable that quietly protects your nephrons and helps reduce the waste load your kidneys fight daily. It is gentle, versatile, and fits easily into low-potassium meal plans. This is the ideal way to begin supporting better filtration. The first item on our list is cauliflower. Cauliflower often gets overlooked, yet it carries a combination of nutrients that support people dealing with rising creatinine. Many stage 3 kidney patients struggle with inflammation inside the tiny filters called nephrons, and cauliflower offers gentle support for these stress structures. 1 cooked cup gives about 55 milligrams of vitamin C, and this helps reduce oxidative stress that can damage the nephron walls over time. That is important because oxidative stress creates unstable molecules that push creatinine higher when filtration slows. The same serving provides about 16 micrograms of vitamin K, which helps repair tissues that constantly face irritation during filtration. Healthy tissue repair allows the kidneys to handle daily waste with slightly more efficiency. Cauliflower also gives about 54 micrograms of folate in 1 cooked cup, and this supports healthy cellular turnover inside kidney tissue. Stronger cells can resist inflammation better, which may ease the overall filtration burden. Another helpful nutrient is choline, which appears at about 40 milligrams per cup and helps lower homocysteine. High homocysteine can damage blood vessels that bring oxygen to the kidneys, so bringing that level down supports better circulation through the filtration units. Cauliflower also carries only about 176 milligrams of potassium per cup, and that is much lower than many vegetables, which makes it safer for someone in stage 3 kidney disease. Too much potassium can overwhelm weakened kidneys, so low-potassium vegetables help maintain a safer balance. Cauliflower naturally contains glucosinolates, which are antioxidant compounds that support detox pathways. These compounds help the body handle toxins, so the kidneys do not face the full workload alone. They also give the body material to produce sulforaphane, and research at Johns Hopkins has shown that sulforaphane supports anti-inflammatory pathways inside the body. This matters because inflammation around the nephrons can make creatinine rise due to reduced filtration strength. Lower inflammation may ease this pressure and allow waste to move through the kidneys with slightly more stability. Hydrogen peroxide and free radical buildup can stress the kidneys, yet cauliflower helps reduce these harmful molecules. That reduction eases the filtration process because less oxidative load means less energy required from each nephron. Cauliflower has a low phosphorus level compared with many vegetables, which helps reduce metabolic stress. The kidneys struggle to remove phosphorus in later stages of kidney disease, so choosing vegetables with naturally lower phosphorus often supports better comfort and stability. The texture of cooked cauliflower also makes digestion easier because the body does not need to break down heavy fibers. And easier digestion leads to fewer toxins entering the bloodstream from the gut. The ideal serving for most people with stage 3 kidney disease is between 1/2 cup and 1 full cup of cooked cauliflower per day. This controlled amount prevents excess potassium and keeps digestion smooth while still providing key nutrients. It works best when eaten at lunch or early dinner because this timing reduces the risk of nighttime bloating, which is common among people with slower digestion. Pairing cauliflower with olive oil helps your body absorb fat-soluble nutrients and provides anti-inflammatory support from the monounsaturated fats. Fresh herbs also enhance flavor without adding stress on the kidneys. Low-sodium spices work well because high-salt seasonings can push blood pressure upward and make creatinine climb through added strain on filtration. People should avoid cheese, cream, or salted toppings because those add high sodium and high phosphorus. Both of these can increase the workload on the kidneys. Do you ever notice swelling after eating salty meals? Many people with stage 3 kidney disease feel the effect within hours. Cauliflower shines when prepared simply. Cream-less cauliflower mash offers a comforting texture without the heaviness of dairy. Steaming the florets until soft, then blending them with a small amount of olive oil creates a smooth consistency that still supports kidney health. Roasted cauliflower with turmeric offers another safe option. Turmeric contains curcumin, and curcumin supports anti-inflammatory actions in the body. Just keep the seasoning low sodium because packaged spice blends often carry hidden salt. You can roast cauliflower by cutting it into florets, then tossing with a small amount of olive oil and turmeric before cooking it in the oven until golden. Avoid high salt rubs and broth mixes because they often contain ingredients that challenge kidney balance. Even simple choices like avoiding canned broths help protect kidney function. When buying cauliflower, choose heads that feel heavy for their size, because this usually means the florets are dense and fresh. Tight florets without brown spots show good quality and higher nutrient retention. If the head feels light or the florets look separated, the vegetable may be drying out and losing nutrient value. Avoid pre-cut cauliflower bags if they give off a strong sulfur smell because that often signals spoilage. Store unwashed cauliflower in a breathable produce bag for up to 1 week. Washing it before storage increases moisture and speeds decay. Organic cauliflower does not have a major nutrient advantage over conventional cauliflower, yet some people prefer it because it may reduce pesticide exposure. Sensitive kidneys may respond better when the overall chemical load in the diet is lower, even though the difference is small. Conventional options are still safe when rinsed well. Raw cauliflower can cause gas in some people, so lightly steaming it helps reduce digestive discomfort. Steaming breaks down fibers while still keeping nutrients available. People who take thyroid medication should avoid very large servings because crucifer vegetables can affect iodine pathways. This effect is minor at typical intakes, but caution prevents problems. Sodium-heavy seasoning completely cancels the benefit of this kidney-friendly vegetable because high sodium challenges the kidneys and raises blood pressure. Seniors may digest cauliflower better when pairing it with fresh ginger. Ginger helps reduce bloating and supports smoother digestion. Now that we have looked closely at this gentle and low-potassium choice, it is time to move to a vegetable with stronger pigment and higher circulation support. The next option supports nitric oxide pathways and helps the kidneys work with smoother blood flow. We are shifting our attention to beetroot. Before we continue, tell me where you are watching from and what stage 3 kidney issues you are dealing with right now. If you are trying to lower creatinine and support your kidneys naturally, make sure to subscribe to Kidnease and turn on notifications. If this helps you, type 1 in the comments or 0 if it does not. Beetroot often brings a strong reaction from kidney patients because its color seems intense, yet this same color signals a group of nutrients that can support people dealing with rising creatinine. Each cooked 100-gram serving offers nitrate compounds that help widen blood vessels and encourage better blood flow toward the kidneys. Improved blood flow supports filtration because the nephrons depend on oxygen-rich circulation to handle daily waste. Cleveland Clinic has discussed how nitric oxide formed from these nitrates supports vasodilation, and this can make the kidneys work with slightly more stability during each filtration cycle. This same portion provides about 2.8 grams of fiber that helps reduce nitrogenous waste buildup. When you digest fiber, it slows the movement of waste in the gut and reduces the absorption of harmful compounds that eventually push creatinine higher. Strong fiber intake becomes even more helpful when the kidneys lose efficiency because it gives the body a second pathway to trap toxins before they enter the blood. Beetroot also offers about 80 micrograms of folate, which supports cellular repair inside kidney tissue. Cells that repair well can resist inflammation longer, and that may help keep creatinine levels steadier. Betalains are the red and purple pigments inside beetroot, and they act as strong anti-inflammatory compounds. These pigments help calm irritation in the tubules, which are the small channels inside the kidneys that manage water and electrolytes. Tubular inflammation can narrow these channels and reduce filtration strength, so lowering that inflammation becomes important for stage 3 kidney disease. A cooked 100-gram serving of beetroot contains about 259 milligrams of potassium. This is a moderate amount, so safety depends heavily on portion control. People with stage 3 kidney disease must balance potassium carefully because the kidneys cannot always remove excess potassium fast enough. Beetroot provides about 4 milligrams of vitamin C and about 0.3 milligrams of manganese, and both help support enzyme pathways that handle oxidative stress. Oxidative stress increases waste production inside the body, so reducing it helps protect the nephrons. Manganese also supports antioxidant enzymes that help manage reactive molecules that would otherwise irritate kidney tissues. This creates a small but meaningful benefit for people looking to stabilize creatinine through diet. Let us look into how beetroot helps reduce creatinine more directly. Nitric oxide helps expand blood vessels, and expanded vessels allow more oxygen to reach the kidneys during the filtration process. When blood moves more freely, the kidneys can clear waste with less resistance. Betalains help reduce tubular inflammation, and reduced inflammation keeps the filtration channels open. Fiber reduces the amount of waste precursors entering the bloodstream because it traps some of them in the digestive tract. This means fewer toxins reach the kidneys, which eases the overall filtration workload. The potassium content in beetroot forces careful portion control because too much potassium may challenge weakened kidneys. This is why people in stage 3 kidney disease must use measured servings. The ideal serving of beetroot for stage 3 kidney patients is between 1/4 cup and 1/2 cup cooked per day, or about 2 to 3 tablespoons of shredded raw beetroot per day. These amounts limit potassium while giving access to the helpful circulation benefits. Many people enjoy beetroot at midday because the digestive system handles it well at this time. Eating beetroot earlier supports circulation during the day and helps avoid late digestive stimulation that can make sleep more difficult. Steamed beet cubes with herbs create a very simple option that suits sensitive kidneys. Light steaming keeps nutrients available and reduces the dense texture that some patients find hard to digest. Fresh herbs like dill or parsley add flavor without adding sodium, and low-sodium preparation helps protect the kidneys from added filtration stress. Another option is shredded beet slaw made without vinegar. Many vinegars may irritate sensitive stomachs or add unnecessary acidity, and some kidney patients react poorly to this. Adding lemon is fine for those who tolerate mild acidity, yet it is safer to skip it if someone struggles with acid reflux or stomach discomfort. Pickled beets should always be avoided because they are often high in sodium, and high sodium harms kidney balance and increases fluid retention. Strong ingredient quality makes a difference. Firm bulbs indicate better moisture retention and stronger pigment concentration. Bulbs that are small to medium often taste sweeter and are easier to digest because their fibers are less mature. Pre-cooked vacuum-packed beetroot should be skipped because preservatives in these products may add extra metabolic stress for weakened kidneys. Many of these preservatives travel through the kidneys without offering any benefit, which increases the load on filtration. Fresh beetroot should be stored in the crisper drawer where it can last 2 to 3 weeks. This slower rate of decay helps maintain its nutrient profile over time. Organic beetroot often contains deeper pigment due to the soil conditions used, but this is optional because both organic and conventional options deliver similar nitrate and fiber levels. Beet greens are high in potassium and should be kept separate because they are not safe for stage 3 kidney patients. Potassium-rich greens can raise potassium levels unexpectedly, so discarding them is the safer choice. Beetroot itself may cause beeturia, which is harmless red urine. This often alarms people, yet it simply shows that beet pigments moved through the urinary tract. Overuse of beetroot can raise potassium and should be avoided, so any increase in daily amounts should be discussed with a healthcare provider. People with diabetes must monitor glucose when eating beetroot because natural sugars in beets can raise blood sugar. Sports nitrate supplements should never be mixed with beetroot because together they can create excessive nitric oxide, which may drop blood pressure too fast for those with kidney struggles. If this has been useful so far, please like this video. A single click tells YouTube that kidney stage 3 guidance matters and helps kidneys reach more people who need this information. If you think someone else should know this, tap that thumbs up now. Now that we have examined this rich and highly pigmented root, it is time to continue with a vegetable that supports kidney health in a much quieter way. The next option eases acid load, supports smoother digestion, and helps reduce irritation that can push creatinine higher. We now move toward green beans. Green beans often look simple, yet they offer a mix of nutrients that can support people with stage 3 kidney disease. One cooked cup contains only 166 milligrams of potassium, which is considered low and far safer for kidneys that struggle to remove excess minerals. Low potassium foods play a key role in creatinine control because they prevent dangerous buildups that force the kidneys to work harder. This same cup carries only 38 milligrams of phosphorus, which is also low and helpful because phosphorus tends to rise in people with weaker kidney function. Keeping phosphorus down helps protect the blood vessels and heart, which often come under pressure as kidney disease progresses. That single cup provides about 764 international units of vitamin A, which supports tissue health in the eyes, skin, and immune system. Healthy immunity reduces the risk of infections that could raise inflammation around the kidneys. The serving also offers about 14 micrograms of vitamin K, a nutrient that helps maintain normal clotting and supports bone structure. Stable bone health matters during kidney disease because mineral imbalances can weaken bones over time. Green beans also carry about 4 grams of fiber, which plays a direct role in reducing toxin reabsorption in the colon. Reduced toxin reabsorption gives the kidneys less waste to filter and may help stabilize creatinine. Flavonoids in green beans offer anti-inflammatory benefits and help protect the nephrons from oxidative stress. Oxidative stress forms when harmful molecules accumulate and damage tissue, and kidneys under strain naturally produce more of these harmful molecules. Green beans have a low mineral load, which lowers the burden on weakened filtration units. The National Kidney Foundation has often pointed out the value of low-potassium vegetables in creatinine control because they reduce metabolic strain. When you hear about vegetables that support the kidneys, it is often the ones with lower minerals that give the safest and most consistent results. Let us take a closer look at how these nutrients work toward creatinine reduction. Green beans create a low acid load inside the body, which means the kidneys do not need to work as hard to balance pH levels. A lower acid load supports easier filtration because the kidneys can focus on removing waste rather than correcting chemical imbalances. The fiber inside green beans binds waste precursors inside the colon. These waste precursors would otherwise travel through the liver and eventually add to the total waste load the kidneys must process. When fiber catches these compounds early, the kidneys handle less stress. Anti-inflammatory flavonoids support the nephrons by reducing the oxidative damage that slows filtration. When the nephrons stay healthier, creatinine tends to stabilize because the kidneys handle waste more smoothly. Green beans are also gentle on digestion, which makes them helpful for seniors who often experience slower bowel movements and gas. Gentle digestion reduces toxin absorption and prevents digestive discomfort from interfering with appetite. Have you noticed heavier foods cause more stomach strain and sometimes make you feel more tired? Many kidney patients share that experience because a stressed gut sends more waste into the bloodstream. The ideal serving of green beans for people with stage 3 kidney disease is between 1/2 cup and 1 full cup per day. This amount offers nutrients without risking mineral buildup. It is often best to enjoy them at lunchtime or in the early evening because this timing allows digestion and kidney function to work steadily through the day. Herbs pair well with green beans, and olive oil adds healthy fats that support nutrient absorption. Garlic-infused oil can provide strong flavor without the irritation some people feel with raw garlic. Canned green beans should be avoided unless they are labeled low sodium, and even then it is important to rinse them thoroughly to wash away extra salt. Steamed green beans with olive oil drizzle create a simple and kidney-friendly dish. Steaming keeps the texture tender and reduces the chances of digestive discomfort. A light drizzle of olive oil adds smoothness and flavor while helping reduce inflammation through healthy fats. A second recipe many people enjoy is a green bean sauté made without salt, tomato, or high-acid seasonings. Cooking them with herbs and a small amount of garlic-infused oil keeps the dish flavorful without stressing the kidneys. Many people find that gentle cooking methods help prevent gas and improve nutrient absorption. Good buying habits make kidney diets easier. Fresh green beans should feel firm when snapped, which shows good moisture and stronger nutrient retention. Their color should be bright, since dull color often signals age or nutrient loss. Limp beans often contain more fiber breakdown and become harder to digest. Spotted or overly flexible beans should be skipped because they often spoil faster and lose nutritional value. Unwashed green beans store best in a breathable bag and can last about 5 days in the refrigerator. Frozen green beans offer a budget-friendly option and maintain similar nutrient values because freezing locks in freshness. Some people assume all vegetables are safe for kidney disease, yet this is a common mistake because certain vegetables contain high potassium and phosphorus. Green beans avoid this problem and give a safer choice for everyday meals. Raw green beans can cause gas for some people because raw fibers can be harder to break down. Cooking them lightly helps soften these fibers and improves comfort during digestion. Restaurant versions often contain large amounts of salt because salt enhances flavor and extends holding time in kitchens. High-sodium meals force the kidneys to hold extra fluid and raise blood pressure, and this can push creatinine higher. Green beans are safe for most medications, although people who use blood thinners should maintain steady vitamin K intake to keep dosing stable. Seniors often benefit from chewing green beans thoroughly because slower chewing helps digestion and reduces bloating. Smooth digestion supports regular bowel movements, which lowers toxin absorption and protects the kidneys from additional waste pressure. Let us move forward now because the next part of this guide shifts from food to a practice that works with the body's natural rhythms. We have covered the top vegetables and their benefits, and now we will look at a technique that can support waste removal without placing extra strain on the kidneys. We now continue toward gentle morning mobility and hydration cycling. Gentle morning mobility works as a steady way to support kidney health because it boosts circulation at the start of the day. Light movement for 5 to 10 minutes signals the muscles to warm up, and this warmth increases blood flow toward the kidneys. Better circulation improves perfusion, which means more oxygen-rich blood reaches the nephrons that filter creatinine. University of Michigan. Exercise physiology research has shown that simple movements can support renal blood flow by reducing stiffness in the major arteries. This routine begins with about 5 minutes of ankle circles, knee lifts, and trunk rotations. These slow movements encourage joint mobility and prepare the muscles for activity. Another 5 minutes of slow walking indoors or outdoors activates the large muscles in the legs, and this helps reduce muscle breakdown. Muscle breakdown raises creatinine, so anything that protects muscle tissue offers kidney benefits, especially for seniors. Hydration cycling supports this routine by timing water intake through the day. Drinking most fluids between waking and 3 in the afternoon helps the kidneys filter steadily. Reducing fluids 3 to 4 hours before sleep prevents nighttime overload. People should avoid overexertion because this raises creatinine temporarily. Drinking too much water at once can disrupt electrolytes. Skipping movement increases stiffness, which leads to more muscle waste products and higher creatinine. Now, let's bring everything together so you can use each step with clarity. Cauliflower helps reduce filtration stress because it is low in potassium and rich in antioxidants that support detox pathways. Beetroot offers nitrate compounds that support circulation in controlled servings and may improve kidney perfusion. Green beans provide gentle fiber and low minerals that help stabilize creatinine for stage 3 kidney patients. Gentle morning mobility and hydration cycling support, steady waste removal and protect muscle tissue from breakdown. If this video supported you, do not leave without subscribing to Kidnease because we focus only on kidney disease stage 3 and above. And if you feel I understood your struggle and offered something that truly helps, type the word relief in the comments.